For those of you who don't know me, my name's Alexis Potaman. I'll be our MC for today. We're really excited to have you all here in person and online. Behind me, you can see our core values, including human hands solve human problems, and meaning comes from making a difference. We kind of put those values into action this week. We donated a couple of rounds of food to a couple of hospitals in the area, to the ICU department, so we're really excited to be putting our values into practice. So if you see Will, he was the one who really spearheaded that, and be sure to tell him that you appreciate the effort of showing our appreciation to all of the hospital workers on the front line with COVID right now. So we'll get started with our main talk. Today it'll be presented by Oasian Perla Rivas. She's also from our Galveston Bay Oasis community, so not planned, just happened to work out really well that way. She is on the board of directors. She serves as the secretary, and she's been part of the Oasis community for several years at this point. She will be speaking on being an essential worker during COVID. So please help welcome to the podium, Perla Rivas.
Sorry, this is a little weird. I haven't taken off my mask in public in a while. Okay, well, thank you for inviting me today. I appreciate that. It's nice to speak again in public. It's been a while since we've been together at our Galveston location, so it's nice to see familiar faces and be back in the area. So I'm just gonna go a little personal and talk about my experience as an essential worker, talk a little bit about my husband who's here that also is an essential worker, and just let you know how it's been for us. I'm sure a lot of this is preaching to the choir, and I know a lot of you guys are in the same situation. So let me just keep on going here. Okay, so who is deemed as an essential worker per the Economic Policy Institute is basically people who work in food and agriculture, emergency services, transportation, healthcare, government, the financial sector, energy, water and wastewater management, and the chemical sector and critical manufacturing. So I know this is a little bit skewed in Houston. Of course, there's a lot more people who work in construction in this area, a lot more people who work in the plants. So there's a little bit of a disparity in our region. And so another big thing about essential workers is that they're a huge group of our population who is a minority. And so that comes with its own sets of challenges. And so from a Lancet article that was published during this COVID timeframe, they reported that there was a huge disproportionate effect to Black and Latino community members. And for example, in New York, 60% of their positive patients were Black or Latino. Another big one here in the Texas area was a meat processing plant. I don't know if you guys remember, just as the surge of COVID began, about 700 cases of workers tested positive. And not always are those workers legal citizens, so that comes with its other sets of challenges. Another one was Walmart in Massachusetts had 81 employees test positive in that first wave in May. So people who are, helping us get our food, our healthcare products are also affected. And then also people who work in transportation were disproportionately affected. This one just specifically talks about New York. About 4,000 of their employees had tested positive in that first wave of COVID. And this is a really good article if you guys want to look at it. It's called The Plight of Essential Workers During COVID-19. And so referring to the immigrants, so a lot of them who were working in the meat processing plants don't have access to that wave of help that some of us did get. So those nice checks that came through for some of us, they were not receiving any of it. So one of the requirements is that you have to have a social security number to be able to get any type of care. And the people who are here with the non-residential status do get a number called an ITIN number, which kind of is equivalent to a Social Security number if you are a non-legal citizen. And so that was one of the things that they thought, okay, well, I'm registered, I'm going to my court dates, I'm showing some of the things that I have to do on my end to show that I'm here, I'm paying my taxes, but that still did not grant them access to care in that first wave of checks. So in the second wave of checks, they did allow people who were married, if one was a citizen and the second was not, but had an ITIN number, they were allowed access to receiving some of this money. And then in the third wave of checks, that's when they decided that even if one person had a Social Security number, so if a child had a Social Security number, their parents could petition on behalf of that child to get that care. So unfortunately, none of the payments were retroactive. So let's say you missed 1 and 2 and your kids were citizens, that didn't count, you only were eligible for the last check. So I know that's kind of one of the things that people were talking about. Well, what about all the immigrants coming to the US to get vaccinations and are gonna take all the money from the government? Well, that really wasn't the case. And there's a link down here, it's the immigrant eligibility for public programs during COVID, and it just kind of explains what access to care, to health care, access to money from the government, kind of where to find resources if you're in that circumstance. Another big thing that happened during COVID was the disparity of work that women were responsible and are still responsible of doing. So one of the big ones I think we were hearing in Houston was that there was a big spike in domestic violence. And so a lot of the women who were already in difficult circumstances couldn't leave their homes because their husband was providing the income for the family. So if you're kind of making up your plan to go and you don't have resources and everything is shut down, where do you go? What do you do? So a lot of the phone calls to those specific centers that receive some sort of help for women started, spiking. And there's still a lot of women who are in this circumstance that still haven't been able to leave. Another one is unpaid work. So I think there's a lot of misogyny that still happens in our country and worldwide. And so I feel like the disparity already was heavy on women, where maybe women do 70, 80, 90% of the housework. And so now you're at home, and now you have your kid at home, and you're in charge of taking them to school, making sure they're on the Zoom call, making sure they have their mask and everything they need for school, taking them to doctor's appointment, doing your work at home, finding time to do this and that. So it just becomes very, very overwhelming. And so before the pandemic, one of the statistics was that women did 3 times as much housework and unpaid work than men did. So just imagine how much that disparity went up during COVID. Another one was there's a huge amount of healthcare workers that are women. So the nurses, the phlebotomists, the people that are cleaning our healthcare spaces, the people that are cleaning our schools, those tend to be women or minorities. And then another big thing was women's health. So access to abortions, access to just getting your gynecological care if you were pregnant during the pandemic. My sister ended up having her kid during this year, and her husband was not allowed to go to any of the visits up until the birth. So kind of one of those things where you bond as a couple was not something that you were able to do. Or if you got some bad news during an OB-GYN visit, that would be something that you would kind of have to deal with on your own and go back home and share with your spouse or significant other. Another one is that there were a lot of economic shocks, like we were talking about. If you were the person making the money and now you don't have that access anymore and your job has shut down and it's an indefinite time, then what do? What happens to that money? What other resources are there for you? Do you pick up a second, third, fourth job? What's the plan for your family? And some of the statistics I pulled up is that about 81% of the overall world population was affected by the lockdown measures that happened kind of mid-year. And 61% of those workers were from the informal sector, and 90% of them were from low-income and middle-income countries. And those people often lacked access to health care, didn't have a lot of money and resources to get to those places that would provide care for them. And then the last one is the lack of PPE. So that first wave, when everyone was discussing, should we wear masks, should we not wear masks? And so I think the big push at the time was, let's keep the masks for the people who are really, really in desperate need, already working at the hospitals, trying to get people in there and dealing with their circumstances. And then we all decided that we all needed masks, and then it just depleted what we did have. And then, of course, the lack of prepared infrastructure and government regulations did not help. But a lot of people, especially nurses, reported that they were using the same N95 mask the whole day, or they were using just a regular cloth mask instead of any type of PPE protection. Like at my job, we started making our own hand sanitizer. We were trying to order, masks and gloves from Amazon and trying to kind of stock up because we knew that big wave was coming. And this is a little bit of a graph from the CDC talking about overall who is more exposed to COVID and what makes that exposure greater. So one of the risks that they were talking about was crowded situations, close and physical contact, enclosed spaces, and duration of exposure. So one of the big things that happens in minority families predominantly is that we live in multi-generational homes, which means I live with my aunt, my grandmother may be living in a different room, their nieces may be living in the same room as well. So there's really like 4 separate families living under one roof. And if one person gets COVID, that's just gonna spread everywhere. The other thing is, if you're working in a retail or if you're working at Walmart, it's very difficult for you to remove yourself from that circumstance because there's going to be an influx of people all of the time. So one of their statistics here was that 2.8% or 2.8 times greater was the amount of cases that were presented from American Indian and Alaskan Natives. Asian was 1.1 times greater. And then Black and Hispanic families were between 2.6 and 2.8. So it just shows the disparity of how many more cases, hospitalizations, and deaths in the groups. Okay, so my job is to work as a clinical research coordinator at a dermatology clinic. So we see people who have like eczema and psoriasis, prurigo nodularis, and different acne issues. So we really couldn't shut down and say, hey, we're just gonna see you from afar or kind of mail your medication to you and assess all of these different time point needs. So we were open, never really shut down Monday through Friday, 8 to 5 during the whole pandemic and still until now. And so the way that our job tried to mitigate some of this was allowing us to work 1 week as a team 1 week as a team 2, where they had a coordinator, a nurse, a doctor, and a phlebotomist available for that whole week. So some of the issues that happened is we're kind of covering for each other's patients. So I have 10 clinical trials that I'm in charge of, but in our facility we run about 40 clinical trials. So we all had to be available to do your clinical trials. So if a patient showed up one day and had some needs, then I had to kind of quickly learn the protocol, the requirements for it. So that was a little bit stressful, but we were kind of grateful that we could have that 1 week off and not have that much exposure. But that only lasted for about 3 to 4 months because there was a big need, and we were also pushing new clinical trials to open up, so there wasn't that possibility to just stay home. And of course, while we were home, we were still assisting in the back end, entering data, answering emails, doing all of that backup work. The other thing is that we have monitors that come from the different pharmaceutical companies to overview our chart work and all of our information, make sure everything is correct and being run properly. So you kind of have to prep, and usually you would have about a week to prep where you wouldn't have a lot of a patient load, so you could kind of clean up your work, make sure everything's done correctly. But that kind of got limited to maybe 1 day to clean up your work. The other thing was, because we had so much exposure to people that were immunocompromised, is that you're highly susceptible to catching COVID. So they would catch COVID, they would come to the office, we would get COVID, or someone in our staff would, and then they would be out for 2 weeks, and then everyone would have to get retested. So we had a lot of nasal swabs going on during pretty much for 6 months straight. After that, another big thing that we started doing was accommodating remote visits. So the patients would see us kind of over like a Zoom call that was HIPAA approved, and we would do the visit, take vitals, kind of look at their different lesions on their body, and then either ship their medication to them or have them do like a drive-by and do an exchange. So that was pretty interesting. And the clinical trials that we do can be a phase 1, 2, or 3. So usually if it's a phase 1 trial, the visits are much more frequent, where we would see the patient probably every day or every 3 days. And then the phase 2 is kind of a bigger group of people where they're testing the medication for its effectiveness. So our trials could be up to 20 patients coming on a weekly basis. And then the phase 3 is really testing one medication versus another. So maybe a medication that's on the market that's called Otezla, that's a pill, versus a possible other one that Pfizer's coming up with. So testing the differences between them. So during this time, my husband and I, when COVID was barely starting in that month of January, where we were starting to get that information of, this is going to be a worldwide pandemic, the companies in Houston started kind of monitoring what was happening and decided to start laying off some of their employees to avoid having to compensate them for COVID pay. So my husband was part of that initial group that got laid off in January, which meant we didn't have an income that we really needed. So that was kind of a big, scary moment for us, because when will that job come? When are they going to reopen? Who's first on the list? Is it a seniority thing? Is it a necessity thing? So what we decided, and I kind of pushed, was that he needed to go Instacart. And so he was picking up groceries from different facilities like H-E-B, Kroger, Sam's, Costco, or you could do alcohol delivery, where you kind of just do a little kind of course on how to properly give people alcohol and how to check the verification of a driver's license and age. And so he was doing that, and a big thing of that is you're kind of in competition with the bots. So you would open your little app, and usually the promotion was that you're going to have an access to an unlimited supply of orders in Instacart. And the way they market it is that you could make up to like $100 in a couple of hours. So the problem that happened was when you opened the app, you wouldn't see any batches available of places to go pick up groceries. And if you did, and those big orders that are like $70 worth were taken by the bots. So people were paying third-party companies to pull those orders from Instacart and giving them to them if they paid like a $5 surcharge per order. So that was leaving you with smaller orders that were $9 or $12. So by the time you drive from here to H-E-B, you pick up your $10 worth of merchandise, then you drive all the way back to the other side of town and drop it off. Is it really worth it? And the problem is, no, it really wasn't worth it, but we really needed the income. So I was like pushing him on a daily basis, like, go get more orders. Try to find more places where you can go. Stand in certain parts of the city, because then you'll have, you'll attract more zip codes that are closer to our phone line. So it was just kind of pushing that flexibility of what to do. And then the other thing is, sometimes when you're at different stores, like for example, Costco by where we live, near the Clear Lake Webster area, Costco doesn't have a really good Wi-Fi system, and the app works off of the Wi-Fi of your own phone company or the place that you're at. So let's say I'm scanning this produce and the barcode doesn't pop up, then I have a cart full of things that I can't really say I've gotten already. And so that means I have to wait until the Wi-Fi finally comes online, and then I have to go outside of the store and kind of reset the thing, and then finally I can go and pay for the groceries, and then I can go deliver it. So one of the things that happens is you have a time frame that you're supposed to not max out. So for example, if it's a small order, you should only be at the store for 10 minutes to pick up 10 items. So if your Wi-Fi didn't work and you were there for an hour, then the customer dings you for not bringing the items in time. And of course, the customer will never see all that you had to go through on your end to get the groceries to them. So for a while there, we were working together on weekends and picking up big orders. So during the time when people really wanted to buy a lot of toilet paper and the bottled water, so we were going to Costco and Sam's to get those big orders, and we would get like 20 cases of water, 4 cases of toilet paper, and you're like fighting everyone at the grocery store. So that was a really interesting time for us. And then it really taught us we really would not work together long term. That would not be something we would want to be doing. He has his job and I'll have my own. And the other issue is you only get $7 per order. So let's say the order was 60 items. You would really only get paid $7, maybe an additional $3 for a heavy order. So if you had to pick up a lot of water bottles, or if there were a lot of big items that you paid, and then whatever the person wants to tip you on top of that, then that's how they come up with the amount that you get. So for example, let's say I took too long bringing an order in, and the customer got upset. They may reduce a $10 tip to $3. So I picked up 60 items for $10 by the time the order was done. So it was kind of playing a game of, he'll look at the cart, look at the order, and he'll call out the items, and so I'll grab all the items, he'll scan them, and then we'll kind of work around that issue. So one of the things that Instacart did institute was that they started sending out 1 hand sanitizer and 1 mask per person that was registered on Instacart. So we were grateful for that because it was hard to find at the time, but 1 of those was really not enough. So we always appreciate generous customers who tip, because there's a lot going on in the back end that you're not necessarily seeing. Okay, so his regular job is working as an electrician. So after the layoff happened, he did his Instacart, and finally he was able to get back on his regular job. And so he's currently working at IAH, and they're kind of running all of this wiring, which I'm sure he could explain in better terms. But basically, that's what they're doing in that area. And the problem is, the people that work at the plants in construction are not necessarily vaccinated. And they also don't believe in wearing masks. So even if you are vaccinated and you are wearing your mask, you're consistently exposed to people who aren't. So what happens to your health? And what happens when you go home to your family members or your friends? So that's always one of the issues. And then the other problem is it's a very conservative environment. So there's nobody pushing for that mask usage or vaccination usage. And then it's also a space where there's not a lot of AC and filtration of air. So you're kind of enclosed, working in closed spaces. And the shifts are long, they're 10-hour shifts. You're carrying heavy equipment and all of your tools, so sometimes that can be a 50-pound bag of tools that you're wearing in your backpack. Sometimes it could be 100 pounds, and you're doing all of this wiring and pulling of things. And then it just is a very intense job. There's a lot of labor involved and not a lot of break times as well. So what we did was to try to take a lot of precautions because we knew we were both exposed to a lot of COVID at our different jobs. And so what we did was avoid our family and friends. So my husband basically has 10 siblings, and they have their kids as well. So we completely avoided his family, which we regularly would have done anyway, so it wasn't like a huge difference. And that's his choice. And the other thing was also to avoid any big events. So in Latin families, going to 15 birthday parties when the daughter turns 15, or going to a baptism or a first communion or someone's birthday party, is always going to be a gathering of over 30 to 50 people. So that was just not something safe to do at the time. And then things that I missed were, for example, the birth of my niece. My sister was the first baby of the family. So my parents live in Mexico. And so I grew up in Mexico half of my life. So it's very different when you kind of see what's going on there versus what's going on here. So here we have an abundance of masks, an abundance of vaccines, an abundance of PPE now. And in Mexico, you really don't have access to all of those things. So when the vaccines started coming out, the way it happened in Mexico was they started vaccinating the most underserved communities. So the very small towns that were having a lot of COVID cases, those people got their vaccines first. So my dad is a diabetic, he has hypertension, he has hyperlipidemia, he has some heart issues, and he's not able to come to the US. So we were trying to find a place for him to get a vaccine. And one of the problems is there were like 3 different types of vaccines. There was the Russian vaccine, there was the Chinese vaccine, and then there was like the Pfizer and the Moderna that was available to some people. So we scouted for places for him to get one, and the closest one was a state away. So we used to live in the state of Mexico that is equivalent to Texas, so a large state. So he drove like 6 hours to a different state, had to register as a driver's license person in that state, then sign up on their website, stand outside for 10 hours to wait for your vaccine, finally got vaccinated, and then wait for the second round of vaccines that become available and for the state to call you when your vaccine is available. Versus us, that we can just walk up to Walmart, Walgreens, HEB, I'm here to get vaccinated, thank you, goodbye. So it's a very different environment. And the other thing is the tests to check for COVID here are free. Like if you go to Walgreens, you could just sign up on their website. They can do a little quick PCR test or an NAAT test, and they don't charge you anything. And in Mexico, a minimum of $100, $100 US to get a COVID test. So just imagine the pay in Mexico is less than half of what we make here. So less, $3 per day, and you're having to pay $100. People are not going to get tested. That's just not going to happen. And so another thing was that the borders closed for non-essential workers from US to Mexico and also in Canada to the US. And they also closed for non-residents. So if you were someone that had like a permit as a non-resident, that basically expired. So the day that you go back to Mexico is the day that you stay there and you don't come back until new permits are being given out to people. So there are still people who left during the first wave of the pandemic who have not been able to return. Another big thing was my family was talking about how funny it was to see people that never wanted to enter Mexico flood the border to come and get toilet paper, masks, gloves, and just bring them all from Mexico and take them back to the US because they were running out on this end. So it was interesting to see that finally Mexico was needed during this time. I've had 2 deaths in our family. My maternal side, an uncle passed away just last week of COVID, and my paternal grandfather died of COVID as well. And one of the problems that's happening in Mexico is they're not really reporting the deaths that are related to COVID. So people get tested and they're not reported unless they're tested at a governmental institution. So if you're tested at a public clinic or a private clinic, that's not really counted in the system. And so, for example, they reported my grandfather's death as pneumonia, but his caregivers tested positive for COVID. And of course, later on they said, well, yeah, he did have COVID and that's what he died of. So it just puts people in more of a disparity. So luckily, because we do work in healthcare and he works as an electrician, I was able to get access to the early vaccines. So I got vaccinated late December, mid-January, and then I got him vaccinated mid-January, early February, which we were very grateful for because I know really the big push for vaccines didn't start really probably until May. So we were grateful for that. And I got the Pfizer vaccine and he got the Moderna vaccines. So at a certain point, after being exposed for this for so long, you get tired. You get angry, you get frustrated, you wish you were staying home, waking up at 10 o'clock, logging onto your computer, working for 2 hours, then going to watch Netflix or hanging out with whoever your friends and just chilling for the rest of the day. So that was my big frustration, that I saw a lot of other people getting that opportunity, which obviously wasn't like something that they chose. And so that was a little difficult to comprehend there's different access and resources for different people. So one of the things that I think working as an essential worker is that there's really not a lot of clear expectations of what your role is. Because there's so many things happening at once during COVID, you're expected to do 1, 2, 3, 4 roles while you're working. And so maybe while you worked before the pandemic, you had these 10 things that you would do, and now you have 30 or 40, and you're not being compensated for that, and you're stressing out at work, and you're getting sick, and you're frustrated, and it just kind of all compiles together. I think a big thing too was that you started seeing people, once the mandate for masks were not enforced anymore, you saw people who were like, well, I've already been vaccinated, or I've already had COVID, I'm not gonna wear my mask anymore. And we had to re-educate people and say, hey, you can still pass the virus. That's still one of the issues that can happen. I think also that you're feeling tired consistently, you're not getting enough sleep, you're worried about your work all day, you're thinking about what has to happen for the next couple of days, just that constant fatigue. And I think you lash out to the people that you live with, your loved ones. It creates a lot of just not very good relationships at the time, because you have such a high stress load already, and you're having to add more and more to it. And I think it also brings on symptoms of depression and isolation. And I think it happens to everyone during COVID. I think we're all kind of tired of it. When is it gonna end? When will we be back to normal? So luckily, we had been planning for a couple of years to go on a trip, and we originally wanted to go to Japan, but that was completely out of the question during this year. So we decided to find a place that would be a US territory, just in case the border were to close and we had to get on a plane really quickly. We also chose a place that would require a COVID negative test before we went. So we ended up going to Hawaii for about 10 days, and we were able to just kind of be free for 10 days and visit Pearl Harbor. We hiked up Diamond Head, which was a very interesting hike. We were able to eat a lot of pineapples, a lot of acai bowls. We were able to just enjoy the ecosystem, enjoy different communities, different people. We went to the Polynesian Cultural Center and got to learn about the different groups of Hawaiians that were initially there, and their different languages and their customs, so that was really nice. And they really enforced masks being worn. So everyone was wearing a mask indoors when in proximity to other people. And their vaccination rate at the time was 70%. So that was a really good achievement for them. So after Hawaii, we both tested positive for COVID. And this was not after the trip. So we came back, everything went back to normal, we got back to work, and my husband went back to work. And after that, he was exposed to someone who was unvaccinated, and he wears his mask the whole time when he's at work. So this person happened to be sitting near him when he was eating, and he started feeling really bad that day, so he asked that they check his temperature, and his temperature was 98.2, but really it was 100. So he came home, he was feeling really tired. He woke up the next day with a fever. He started with body aches. So we went and got him tested. And in fact, he was positive. So on the 14th of August, just last month, he tested positive. So then I went and got tested. And I think I went way too soon for the exposure time frame, because I tested negative the first day. And then I went again 2 days after and tested positive. So it was really frustrating, because we had gone so long without testing positive and going through all of these precautions to try and keep ourselves safe. And the Delta variant is just very intense. You know, anybody could get it. And we were both vaccinated. We thought we were doing the right things. We were wearing our masks, you know, washing our hands, doing all that stuff. So for him, his fever lasted 4 days at 103, the body ached and all of that, his runny nose, the cough, and then I started with the cough and the body aches as well. So one of the things that I think a lot of people, at least in my workplace, didn't know is that there is the Families First Coronavirus Response Act, which requires companies, if you have been employed for more than 30 days, to pay you for 2 weeks worth of work. So if it's you that tested positive, that's the mandate. If it's your family member and you're having to care for them, I think the expectation is that they pay you 70% of your original pay. So a lot of people don't know that, and they don't report that they're positive, and they end up going to work, and then they get other people infected. And in his case, while we were going to get him tested, his boss called and said, hey, another 2-3 people tested positive. And later on, another 4 or 5 people tested positive. So they pretty much had an outbreak because of the non-vaccinated population. So what we decided to do, by recommendation of my sister, was go get an IV antibody treatment of monoclonal antibodies. So we live in the Galveston County. So what we did is register online. You have to have a positive COVID test within 10 days. You have to be 65 years or older, or be 12 years and older and have some sort of comorbidity, a high BMI, diabetes, hypertension, asthma, things like that. So we signed up, and really for the BMI thing, and also because I have diabetes. So what we did was basically sign up, you go the next day. He had his first 4 days into his COVID infection, and basically you just go in, register, and you sit there, they take your vital signs, they introduce the IV line, and you get your treatment for 20 minutes. And so while you're receiving your treatment, they check your vital signs again. And by this time, they're doing like 7 people at the same time, all receiving their IV antibodies. And then after you get your dose, which is about 20 minutes, they check your vitals one more time, and then they monitor you 1 hour post-dose just to verify that you're not having any reactions. So the monoclonal antibodies are basically an antibody produced by a single clone of cells or cell line and consisting of identical antibody molecules. I'm pretty sure wherever Will is, he could explain that a little bit better. So the good thing of that is that you start feeling better 12 to 24 hours post-dose. And the big thing about this treatment is that it's trying to prevent hospitalization. So if you already know that you have comorbidities and your likelihood of getting really sick is high, you might as well just go and get it. It's going to help you to feel better. So for him, his fever reduced. In the next 12 hours, he wasn't having to take as much ibuprofen and Tylenol to get that fever down. The muscle ache started to subside. And for me, it took about 24 hours. And I think it's because I had just been positive and started with all the symptoms. So they began doing treatments at UTMB in June, and they're currently doing 60 treatments per day at each facility. And they're doing them for free. So they're free at the UTMB clinics in Galveston, Angleton, and Webster. So if you want more information, I can post it on our links for Houston. So one of the things that happened to me was really weird. I came back from work after the 10-day, 14-day quarantine, and started with my regular work, doing everything I needed to do, and I started producing these circles of rashes on my body. And so I came home and I was super itchy, really worried about what was happening. My husband was like, "You have ringworm." And it was not ringworm. It was actually something called erythema multiforme, which are basically little circles that you get that appear all over your body, which is basically a reason that it's a type 4 hypersensitivity reaction associated with certain infections, medications, and other triggers. So some doctors think it's related to the herpes virus that is lingering in someone's body. It also could just be something that happens after an infection. So for me, it just started with the itchiness, the pain in those areas. It felt really hot wherever the rashes were. And then since I work at a dermatology clinic, the PI, the main doctor, told me like, yeah, this is something that's happening with COVID patients after they've been exposed. It can happen while you're hospitalized, or it can also happen like a month after you've had it. So I currently still have them. And what I'm doing now is taking a pack of steroids because it just consistently got worse, and it started creating like some muscle pain and some different aches. So luckily the steroids are really helping. So there was a study that they did on 4 women who had been hospitalized, and their mean age was about 66 years of age, and their erythema lasted for about 20 days. And it began about 4 to 6 days post-discharge, and it presented on their face and limbs. So some of my final thoughts on our whole COVID experience was get vaccinated as soon as you can, and get your family and friends to get vaccinated. I know it can be a really difficult conversation to have with them. Like in our case, my husband's family is not very okay with vaccines. It's been a struggle to get them vaccinated. A lot of them have tested positive and don't really understand why they would have to get a vaccination post-infection. So that's been a little bit difficult, but I think telling them that there's a money incentive now in Harris County where you get $100 with your first dose, $50 for your second dose, and whatever they're gonna start giving for the third one. I think wearing a mask in public is really important because anyone can get it even if you're vaccinated. And I think for women, it's really important to reestablish expectations with your significant other or spouse. I think if we can have those conversations of what equality is in a relationship, especially in our more free-thinking communities, I think we can change the expectations of what is your half of the work in our household. Does that mean you're gonna be doing the dishes and taking out the trash, or does that mean you're also gonna be scheduling doctor's appointments and making sure our bank accounts are in order? So having some of those difficult conversations, I think, can help minimize the stress load. I think also making some time for yourself, whether it be you kind of closing the door, focusing on what you wanna do, what you wanna watch, going out, working out, or taking your dogs out to the park, whatever it is that makes you feel comfortable and like you're getting some of your normal back. I think also reaching out for help, going to a therapist, a family friend, talking about what's going on, making sure that someone is validating what's happening to you and your experiences is important. And I think being part of communities like this, where we know that what we do helps someone else or affects someone else. So when we got COVID, I posted something on Facebook saying like, keep in mind that your actions or your lack of actions affect other people. The fact that you're not vaccinated, the fact that you're not pushing to wear a mask might get me, might get you tested positive later on and having to deal with an infection that has long-term ramifications. So I liked this little post that I found online, is that we're all in the same storm, but we're not all in the same boat. Some of us have more resources, some of us has less resources. So just keep that in mind when you're out there, when you're in contact with people who are working 24/7 that don't have the capacity to stay home. Just be kind to people. And I just wanted to share little pictures. This is our family, our 2 dogs. So this is basically what Rodolfo was doing when he was off, was hanging out with the dogs, playing on his Switch. He likes to wrap them up in these blankets. So that's kind of our little family.
All right, so again, thank you everyone for being here today. Thank you for joining us online on Zoom. I know that everyone's probably sick of hearing this, but this is definitely unprecedented times that we are all living through. So we appreciate you being here, rolling with the punches, and making this community what it is during these times. So with that, we'll have a couple final songs from Brightwire. Gary usually does his talk, but we have our basket in the back if you feel like contributing a couple dollars in there and making our community what it is. And for the record, this is Miss Zoe, our latest member of the community. So, yeah. So with that, let's go ahead and finish up with a couple songs for Brightwire. Thank y'all.
Like to hide in our shell, obscure the pain and say that we're alone. The only way we're gonna heal these wounds
Is to
be brave and let the damage show. Yeah, let's be brave and let the damage show. Yeah, I know we're all broken, but we're still ways from falling apart. And I believe that all these cracked edges, they make us exactly who we are. Yeah, they make us exactly who we are. Who we are. Thank y'all.